Now, in just the past hour, worldwide, we hit a milestone, 1 million cases. We begin tonight, though, with the extreme new level of preparation that's happening in our community.
Yes, Atrium Health is predicting that Mecklenburg County will not have enough hospital beds to handle all of the patients. We have team coverage live today at 5 on the need and one possible solution. We begin with Channel 9's government reporter Joe Bruno. Joe, you just got off a call about a possible field hospital.
Yeah, the CEO of Atrium says we will not have enough beds when Mecklenburg hits its surge. He is officially calling for a field hospital. The CEO of Atrium says based on their models, they expect the surge in Mecklenburg County to be any time between mid-April and mid-May, depending on how successful the stay-at-home order is followed. The CEO says Mecklenburg County and state partners are in the final stages of logistics for this field hospital, and more information will be shared soon. This morning on a call with state leaders, the county health director said based on our numbers, it is looking like we will need a mass care site, but we need to make sure we have enough personal protective equipment before it opens. The CEO of Atrium says that may have to happen soon.
Using our latest epidemiological statistical data to predict community spread, at peak surge, we believe that we're going to need a significantly more number of hospital beds beyond our current planned surge capacity.
So where will it be? Officials tell me they are still assessing potential locations. However, one possibility is on the campus of UNC Charlotte. Leaders there announced today that they're clearing 6 dorm rooms for the state and Mecklenburg County's use to fight COVID-19. For more on that, here's my colleague, Eyewitness News reporter Elsa Gillis.
And Joe, it's so strange here right now. Normally this time of year, this campus would be bustling with students. Sadly, that is just not the case right now. Take a look at just how much of a ghost town this campus is from overhead, captured by Chopper 9 Sky Zoom today. It's the South Village residence halls that are the ones being looked at right now to help in the response to COVID-19. It consists of 6 buildings. 5 of those buildings have 400 plus beds, according to UNC Charlotte's website. So they have the capability to house more than 2,000 people, though we don't know what exactly they would be used for at this point or what the configuration would be. And we asked the county what specifically the dorms would be used for. We were told that no decisions have been made at this time. And it's not clear how long the buildings could be used for the COVID-19 response. So if this is one of your dorm rooms here and you have belongings left behind, what's next? The chancellor says that they have reached out to South Village residents to hopefully reunite them with their belongings. They have a scheduling plan in place and protocols to ensure proper social distancing. Back to you, Erica.
And Elsa, seeing you out there, I mean, this is another signal that we've entered a new time and all the changes in the community to try to support this effort. Thank you, Elsa.
Let's take a moment now to address one more extreme preparation measure. Viewers have shared this picture outside of Atrium Health in Northeast Concord, calling it a mobile morgue. Now, we did confirm with Atrium that is exactly what these are. These white containers here are mobile morgues. At this point, the hospital system is only saying it's preparing for the possibility of a high number of patient deaths. This is at this point just a precaution. Now we want to take a close look at some of the actual numbers that we're dealing right now in each state. There are more than 1,800 positive cases in North Carolina, but only 16 deaths so far. So the mortality rate is less than 0.9%. There are now 533 cases in Mecklenburg County. In South Carolina, over 1,500 cases tonight. There was an increase in cases in Chester, Chesterfield, and Lancaster counties today. York County stayed at the same 66 cases, and sadly, 31 people have died in the state.
Also brand new tonight, some possible help for many of you who've been trying and fighting to get unemployment. Just in time, we learned these new numbers that came in today. The U.S. Department of Labor saying 6.6 million people filed for unemployment last week alone. That is a major new record. Action 9 investigator Jason Stujanki has spent days now pushing for more help for local workers who spent hours on the phone and online trying to get unemployment help, but they received nothing. Jason, just a few hours ago, you learned that thankfully more help is on the way.
Yeah, that's right, Erica. There are actually two main items I want to tell you about since yesterday. The Commerce Department says it's beefing up its phone systems to handle the influx of calls. We've talked a lot about that. And it's also beefing up its servers to handle all of those people online. Now, keep in mind, about 200 people complained to me so far. They say they were applying for unemployment and the website crashes and that they can't get a real person on the phone. I've been asking Commerce what it's doing to address these issues. Now, yesterday, if you remember, it told me it hired more staff, that it interviewed people over the weekend using Zoom, and that some even started working already. It also told me it's cross-training current employees to help on the unemployment side of things, and that it hired a private call center to relieve some of the burden. Now, around 2 o'clock this afternoon, a Commerce Assistant Secretary spoke at a news conference. He acknowledged the issues and said the state wanted to get the system up and running very quickly, but didn't realize it couldn't handle all of this traffic we've been talking about. So now, as I mentioned, Commerce says it's continuing to make improvements, and the two latest, these phones and servers.
And we understand that for the people who have lost their job, the help can't get there soon enough. We know that a lot of people have had problems accessing our system or getting through on the phones. This is not acceptable.
Now, as I said, I told you yesterday that Commerce is hiring more people. Some have already started, others should be starting in a matter of days, and it looks like Commerce will continue to hire. We now, though, have an exact number for the moment. We're talking 350 people and counting. Guys?
Yeah, Jason, we carried that news conference live. I heard him say he promises that he is going to get this fixed for people quickly. Thank you. There's an Associated Press poll that came out today reporting half of working Americans say they or a household member have lost income due to the pandemic.
Also new at 5 o'clock tonight, a nurse who works in the Mecklenburg County Juvenile Detention Center has tested positive for the virus. Now, the county has a contract with a company called WellPath, and they say one of the nurses came into work and she passed a standard screening and said that she had no symptoms, but about 20 minutes after that, she said she did not feel quite as well and ended up being sent home and going into quarantine. And again, that nurse testing positive. 4 inmates and 4 correctional guards have COVID-19. The state says 1 inmate at Caledonia, 1 inmate at Johnston, and 2 inmates at Noose Correctional have tested positive. 1 guard at Central Prison, Eastern, Johnston, and Maury Correctional each have tested positive. The State Correctional Department says it just got thermometers dispatched to State Prison, and they're now using them to try to prevent the spread.
And we are, again, certainly in an uncertain time, but what always remains clear for our community is that no matter what, we always stand together. I want to show you this. This is what our community is all about. We've seen it so many times with our food drives, school tools drives, coat drives. Well, this today, faith leaders, they were out there handing out free food to car after car as people pass by. Channel 9's Ken Lemon shows us this moving show of support for those who need it the most.
And this line of vehicles you see right here stretch all the way around the corner, even block traffic out on Bessemer City Road for a time today. I saw everything from BMWs to Mercedes cars you don't normally see in food lines like this, but the pastor says times have changed.
Take your left right here.
They had to redirect the multitude of cars packed with grateful faces.
We ain't got much coming in right now. You know, this here is a big impact.
Pretty much well needed,
Yeah.
especially in this time.
Some of them waited more than an hour.
There you go, baby.
To get some of the 11,000 pounds of food provided to Mount Zion Restoration Church by the Second Harvest Food Bank. It came just in time for many.
Y'all didn't have anything?
No, we didn't have nothing.
The pastor says they've operated a food pantry every week for more than a decade.
We've never seen it like this throughout the whole time we've ever done this in the 13 years. But then again, we've never seen a crisis like this either.
A crisis hitting home for people like Rachel Chambers.
I think it's awesome. It's the best thing that could happen.
Watch the pastor's reaction as she tells him she beat breast cancer and just had her last radiation treatment. But now she's suffering from the impact of COVID. Her job as a daycare worker was cut. Most parents don't need daycare because of the stay-at-home order.
We just didn't have enough work.
That's why they're not taking applications for recipients. Anyone can come
3444
and get as much as they can carry. The pantry today was supported by the Gaston County COVID-19 Faith-Based Task Force. They also work to provide donation sites at 3 other locations. Tonight at 6 o'clock, a co-chair for that task force tells me that they're working to do more than keep folks fed. Back to you.
Yeah, so many people in trouble, Erica, maybe can't afford food, and because of the backlog we're hearing about people trying to apply for unemployment benefits, they can't even get money coming in to buy the essentials, and who knows when they'll get it.
Yeah, even more beautiful with that effort today, they didn't turn anyone away, no questions asked. And again, our community always comes together. Beautiful to see.
Well, you know, this virus has already had an impact on the presidential campaign, but especially this summer. Some big changes already in the race for the White House. This morning, the Democratic National Committee said that they're delaying the DNC from July 13th to the week of August the 17th. That's the week before the Republican National Convention right here in Charlotte. DNC leaders said they just didn't know if they could have a safe, successful convention if they kept it in July. Now, we told you last week the Republicans say they're confident their convention in Charlotte will not be delayed. It's actually later than the DNC, even after pushed back. The RNC scheduled for August 24th through the 27th. Party chairwoman Ronna McDaniel still says it's possible the pandemic could impact them. We'll have to wait and see.
Starting next week, a Rock Hill bedding company is going to start distributing 30,000 of those N95 respirator masks to hospitals, nursing homes, and to our first responders. Bedgear's VP of Operations wanted to make the masks in part because he says his stepmother is a doctor at Novant in Charlotte. Some of the masks will be going to Novant, as well as some pillows for those first responders to use at the hospital in between shifts when they want to rest. And they will be sending more masks to hospitals in New York. Carolina Panthers' Christian McCaffrey, he is also stepping up to help.
Yeah, he's raising money for healthcare workers in the Carolinas, and so many of them have been working so hard. He's working with Lowe's for 22andU to support the North Carolina Healthcare Foundation and South Carolina Hospital Association Foundation. He tweeted out this message today saying he's moved by the heroic and selfless efforts of the people on the front lines.
I say we just link together as one, do our part in helping our medical professionals in the Carolinas.
Yeah, so many things are being put into perspective. Obviously, there's no sports on, and this focus is shifting to the people who really are there for us on the front lines, these hospital workers who've worked so hard and, of course, are at a higher risk of getting it themselves.
Yeah, everyone is doing what they can to pitch in.